Do you know why more and more doctors are employed by large health systems today? A part of the blame goes to Obamacare, or more specifically, value-based care financial model that was part of Obamacare. Now, let's do some quick math based on my value-based care simulation model that I published on vbcsim.pcplens.com. Let's take a look at it. Okay, so once you go to our VBC financial simulation model, we are going to follow the realistic case. 100 PCPs, 1,000 patients per PCP, 80% attribution rate. Each patient costs approximately $10,000. We're going to try to save 5%. And our minimum savings rate is 1.5%. And these numbers are going to be important. In aggregate, we have about 80,000 patients and 800 million in total cost of care. Let's take a look at the opportunity. In this case, the 5% of $800 million, approximately $40 million. So that's what we are hoping we can get. But what happens is, we need infrastructure to set up the ACO in order to put programs in place to hopefully try to save that $40 million. And that infrastructure comes at a price. So let's scroll down. In our modeling, we have simulated that approximately the ACO needs $3.1 million. And because the physicians are going to do a lot of administrative work, they are going to lose approximately $86,000 in these 18 months. And for this, we need a funder. And this is where the hospital comes in and says, hey, you need $3.1 million. We're going to give you the $3.1 million. But in return, we need something. First, we are going to take some of the money that you get from the insurance companies if you end up reducing the total cost of care. In this case, we are modeling out 50%. But more importantly, they want referrals. You have all of these independent physicians, they want them to redirect all the referrals to the hospital systems, which is a lot more expensive. And when you calculate that out, what you end up seeing is if the hospital is asking for approximately 60% of your referrals, that ends up costing approximately $31 to $32 million if you assume that sending a patient to the hospital is approximately 22% more expensive than an independent specialist. Guess what? You wanted to save $40 million, but you just ended up spending $31 to $32 million sending patients to hospital-employed specialists. Wiped out most of your savings. So what's the benefit for the hospital? Because you didn't reduce your total cost of care, the hospital doesn't care. They funded $3.1 million, but guess what? They ended up getting approximately $32 million in referrals. More importantly, if some of these physicians say, I'm done because I lost a lot of money, guess what? These physicians are going to get employed by the hospital. So the hospital wins. If there's gain share, they take a portion, they get all their full volume, and when the physicians give up because of the administrative burden, they go sweep these physician practices and buy them out, and next year go to the payers and say like, hey, we are so much larger, we need more money, and they negotiate higher contracts. This is why we get consolidation in value-based care. With that, take care and goodbye.